We are now going to proceed to our second panel of the day, which will focus on global digital cooperation for a world better prepared, collective challenges, and response to health security. This session will examine the principal global challenges related to health and will offer recommendations emerging from the lessons learned from the global pandemic. COVID-19 has demonstrated the need to revitalize multilateralism and build a cooperative international order. This policy discussion will gather the expertise, insights, and vision of World Leadership Alliance, Club de Madrid members, and Boston Global Forum experts from a multidisciplinary perspective to consider different approaches for the transcendent challenges at present for navigating global crises. We are really pleased that this session will be facilitated by Cristina Manzano, who is director of ES Global, a leading digital publication on global affairs in Spanish, and a member of the board of the World Leadership Alliance, Club de Madrid, who has been supporting our efforts for almost 2 decades since the founding of the World Leadership Alliance, Club de Madrid. Welcome, Cristina. Good to see you. Please take the floor.
Good to see you too, Milburn. Thank you very much for your words, and thank you to the World Leadership Alliance and Club of Madrid for the invitation to facilitate this fascinating panel. I also want to thank you, the previous panel and the panelists, because it's been very, very interesting. They've gone through a lot of issues in a very complicated field, especially for non-specialists. So thank you very much also for sharing their knowledge and their insights with all of us. As you mentioned, we want to tackle cooperation in this strange world that we're living in. As it has been repeated so many times during the last months, the COVID-19 pandemic seems to have only accelerated the trends that were already there. The transformation of how we deal with health issues or of how we manage health issues, the health system, was already on its way. But we are now realizing its huge and multi-dimensional potential, thanks to technology mainly. We are living it. Before, in many cases, it was a matter of laboratories, of tests, but we are now living it. So in the last months, we've seen the release of new tools to help monitor the disease, the COVID especially, and how to fight it. Just to mention a few fields where we've seen these advances, we've seen digital epidemiology, tools, we've seen chatbots, helpers, we've seen electronic health record guidance tools, and the use of robots. Robots to either clean and disinfect hospitals or to deliver medical supplies. We've something that seemed to be science fiction, a drone dropping medicines or dropping medical supplies are already there. So in this panel, we want to look at how technology is changing the way medicine is practiced, how it is helping to improve diagnosis and treatments on a global scale, and also including its ethical implications. Some of these aspects have been already touched upon in the previous panels and also yesterday, but we will try to dive more into these aspects. But we also need to look at the implication of these developments for the global digital cooperation and governance. We are here with the Club of Madrid. We are always worried about the future of global governance, and this is a very, very special case. We will start with the vision of the UN because that is our common house, but we will also go and stress the need of improving cooperation and assess global governance in the digital domain in times where this multilateral system is being threatened from many angles. And for that, as you know, we have a sectional panel here. We will be having Mr. Danilo Turk, which is the current president of the World Leadership Alliance and Club of Madrid and former president of Slovenia between 2007 and 2012. We will also have Mrs. Yu Ping Chan, who's Senior Program Officer of the Office of the Undersecretary General and Special Advisor on preparations for the 70th UN anniversary. This week we are starting to celebrate it, and also the high-level panel on digital cooperation. We have also David Silverzweig, Chairman of the Department of Psychiatry and Co-Director for Institute for the Neurosciences at Brigham and Women's Hospital. And finally, last but not least, of course, we have Professor Effie Villena, she's professor of bioethics at the Swiss Institute of Technology, and she's also a consultant for WHO. Before we move on with the panel, let me give you a couple of announcements. During the session, you will be able to be posting questions in the question tool that you have in your screens. Please, I invite you to do so because our conversation will be much richer at the end. Also, I want to announce that we will be having a couple of polls. We want to know your opinion on two very specific items, and they will be appearing on the screens. I will be also announcing them when they arrive. And finally, I also want to ask the panelists to keep their comments brief, especially in this first round, up to 5 minutes, so we then have time enough for discussion afterwards among us and also with the audience. But let me start with Yuping Chan and the vision of the UN. Please share with us what is the roadmap of the United Nations Secretary General for Digital Cooperation. As I said, let's start with the overview and then we'll go to more specific issues.
Much, Christina, and much thanks to the Club de Madrid and the Boston Global Forum for inviting me and the United Nations to speak here today. I've really been honored to be part of this distinguished panel, and I really look forward to the conversation that we're about to have. On the Secretary General's roadmap that you've asked us to comment on, I think colleagues who have been following the United Nations work on digital cooperation is that it's been a little bit late that the United Nations has come to the discussion on digital technologies, but really, we have realized that it needs to be an area in which the United Nations engages with strongly. So starting with the high-level panel on digital cooperation that the Secretary General convened last year, consisting of such luminaries as Jack Ma and Melinda Gates, and a wide variety of individuals, experts, technologists, government officials in the area of digital cooperation and technology, the high-level panel on digital cooperation issued its report last July. Based on that, the Secretary General convened another multi-stakeholder process under Secretary General Fabrizio Coscio that consisted of over 100 entities having discussions on the specific recommendations of the high-level panel and discussing how best to take these forward. Based on those multi-stakeholder cross-regional discussions, the Secretary General then issued a report, the Roadmap for Digital Cooperation, in June this year, where he lays out very concretely in 8 thematic areas his call for the international community to come together to connect, respect, and protect people in our digital age. The Roadmap for Digital Cooperation has very specific, action-oriented outcomes in areas such as universal connectivity, where the Secretary General calls for the world, the entire world, all people to have affordable, meaningful, and inclusive access to the internet by 2030. Digital inclusion, where he looks at the need to ensure that digital technologies reaches all of us, groups and so on, all different groups and people, so that it does not layer on another digital divide on top of already existing inequalities. Other areas such as digital public goods, digital human rights, digital cooperation architecture, and digital trust and security. So in sum, the Secretary General for a world where there is greater global governance of the digital sphere and the cybersphere is laid out in the Secretary General's Roadmap for Digital Cooperation, building on the important work that was already established for us by the high-level panel on digital cooperation. I think, Christina, you mentioned that the Club de Madrid has always been interested in the United Nations because this is our common house. And really, we at the United Nations are really hoping that this increased drive towards digital cooperation, this coming together of all stakeholders in the United Nations as a platform, is a way of bringing together all the interested actors in this drive towards having better global governance of the digital technologies that govern our space. You mentioned, for instance, how COVID-19 has really brought to the fore the fact that we are all dependent on digital technologies. And ironically, this really has been a realization that really has become more stark by the fact that we need digital technologies to be able to connect here today. That also means that we are now even more aware of the challenges that come with digital technologies. The benefits of being able to work remotely, educate ourselves remotely, also come with challenges as well. There is increased incidence of cybercrime, increased vulnerability of children to online child and sexual abuse, ransomware attacks, cyber attacks against health facilities around the world. All these are challenges that have been brought about by the increased digitization and our dependence on technologies due to COVID. At the same time, what remains very stark is the fact that even though you and I and all of us here today can connect online and watch this video and this excellent conversation, there are 3.6 billion people around the world that remain unconnected. That for so much of the world, particularly in developing countries, this luxury of digital technologies and broadband access and the access to the information, the real-time communication, the connection with other people is something that remains a dream for all of them. And this is why in the Secretary General's roadmap, the theme of universal connectivity really underlines a lot of the work that we want to do. It is really an area where it requires even more stepping up, particularly if we are to achieve inclusive global governance for all of the world. The fact that, for instance, besides 3.6 billion people being offline, in developing countries, for instance, less than 20% of their population have access to the internet is something that is very stark. And then, as the world tries to build back better from COVID, makes us realize the gap, the digital divide that exists, which will only be exacerbated as countries push back and develop and try and recover from COVID-19. So this is an area, connectivity, where it requires, again, global leadership and political commitment from all of you. And I welcome all of you to really join us with this push to make sure that the world is respected, has connections, and that people are respected and protected online, as called for by the Secretary General's roadmap. The last thing I want to say quite briefly, and I understand that I'm probably taking a little bit of time, and I'm happy to elaborate on this further, is the fact the Secretary General's roadmap really represents a multi-stakeholder approach. It's not just about governments talking to governments, but it's about bringing us all together, all relevant actors, governments, national regulators, as well as private sector, the technology companies, the scientists, the technical community, and civil society to join in this collective effort to steer digital technology. And this is very important because I think, again, in this COVID-19 experience, we realize that in some ways, it's no longer governments just calling the shots. It's about technology companies that decide the rules of the game and how we engage with each other on social media platforms. It is private sector companies that are deciding in some ways the policies by which you and I interact or work online. So in many ways, digital technologies must be a space where multi-stakeholderism and a cooperative approach between all stakeholders takes place if we are to effectively govern the digital space. The United Nations Secretary General has said that digital technologies must be an equalizer and an enabler. But recognizing the need for cooperation among all stakeholders, he has offered the United Nations as a platform where we can all come together, have discussions like this today about how we can better harness the benefits of technology while still mitigating the challenges, perils, and dangers that they might pose. Thank you, Christina. I look forward to discussing this further with everyone.
Yes, thank you so much. You've posed so many topics and so interesting. And this is clear. We can have the test here for a new global governance because that multi-stakeholderism is also needed in other areas like climate change, like so many others. But we have to face this right now, and it's urgent. So we may have a test case there. Let me go to the first poll of our session today. You have it here. I just need to remind you that you have 1 minute to answer it, but more than enough time. Let me then go through the question very quickly. Do you consider that actions to problems such as the current pandemic should be initiated at the national level? And the answers can be actions must be taken through national decisions to act quickly. The guidance must come from multilateral organizations so that there is a common path and a coordinated response, or leadership and decisions should be initiated at the national level and multilateral organizations can oversight them with some level of executive power. So here that is. And let me move to the next panelist. I want to ask now David Silversvide. You have been talking about the need to have connectivity. That is one of our major challenges. And investment in health system and infrastructure are key for guaranteeing well-being of citizens. But we all know that they are extremely expensive, and we all know some of the challenges that face. In your opinion, how can we address these gaps in these important fields? David, please, the floor is yours.
Thank you, Christina. It is indeed expensive. However, the cost of not implementing and scaling these sorts of interventions is also inordinately expensive. And the cost of physical health, mental health problems, of disability in the world in terms of direct and indirect impact is such that hopefully we can leverage that information and speak with and be involved with policymakers to be able to make the case strongly that the investment needs to occur. Of course, as was just pointed out, it needs to occur for equity reasons as well. And in the larger scheme of things, the ability to have connection, to have more equitable connection, and what we in healthcare term access is something that is the primary thing. Then once you have access, the issue is what one does with that. And this becomes a very important issue. And I think COVID has given a wake-up call and has served as a real catalyst for change, for systems change, which normally proceeds slowly, if at all, and requires culture change within and across organizations. And what we've seen is that because of the health emergency and the contagion and the availability of platforms like this, like Zoom, to be able to provide care in a HIPAA compliant or privacy compliant way is something that we've been able to scale remarkably quickly with the limitations that were alluded to before. And then the next question becomes what we do with that. What are the strengths and limitations of that?
Thank you so much. Let me go to the results of the first poll. They should be appearing in the screen. Yes, they are okay. So all of them think that decisions should start at the national level, but then that multinational organizations should can oversight them with some level of executive power. It's amazing that 100% of respondents went to that. Okay, let's go now to Effie, please. We've been dealing with these challenges of the global system right now regarding technologies and the health infrastructures on the one hand and systems on the other. There are a lot of ethics in this too. We've heard about it in the previous panel too, because it is one of the most the newest thing, the novelties. I'd like you to share with us what is your experience from the institute you work with. What have you detected? What are the main findings that have you detected in this field? And according to the studies that you've carried out, what are the current landscape or one single landscape of AI ethics guidelines? Could you mention some examples that could also help us understand where's the direction we are going to in this very new field?
Sure. And again, thank you for having me here today. This is an exciting conversation. I think one of the things we witnessed during the pandemic, of course, was the fact that we have a really powerful technology, the digital application, the artificial intelligence tools that we can use, and there are already myriads of examples out there of their use. At the same time, what was happening before COVID is that we had a very rich debate and discussion about the ethical challenges that theoretically and practically the application of these technologies are bringing about in our lives, and particularly in health. We've been looking at issues of bias and issues of equity, etc., when it comes to the technologies. Now, when COVID-19 came, the first thing that happened is I hope that if we use technologies like the digital tools that we have, and if we apply artificial intelligence, and I use the term quite liberally here, then we'll have an impact on controlling the pandemic. And I think to some extent we have some really interesting examples. But at the same time, we're realizing some of the problems we had been thinking about before the pandemic. First, and I'll mention, I think, four that I think are particularly critical. The first one is that we had actually little time to develop standards and test technologies that we were very keen to deploy. Some of those we could, some others with little evidence about whether they're effective, whether they can truly help us, they were rolled out. And again, in the domain of health, typically we were quite careful about what we're rolling out. Even for public health and also in population health interventions, we need to have some sort of evidence that things will work. So a lot of the allure of the digital, because it is so powerful, it is so exciting, and we can do things quickly, was that I think we started cutting corners as to, do we know whether any of those things actually work? And that's something that for me is also a lesson that I think we need to carry over. We need standards for these technologies, and we need some evidence that they do what we want them to do before, we go through and just, put them out there to people. The second thing that I think became quite obvious is something that we've been struggling with for a long time. And I'll put it bluntly, this issue of data governance, because essentially for many of these technologies, what we had to do is to use data. The lifeblood of artificial intelligence is data. And we were lacking data governance, at least despite the fact that we've been talking about it for so long. The previous speaker mentioned that we were able to, even despite privacy law, etc., we're able to scale things very quickly, and I agree with that. But again, if we also observe the gap that we have in frameworks, in translating frameworks to practice when it really, really mattered. And again, I think that's something that we need to be able to move forward. The third thing that we also saw is something that the poll perhaps has indicated. Yes, decisions, national decisions, quick responses and action. But what we saw as well is in matters that we really needed international cooperation. And again, within the digital, we're still struggling with that. I'll give you an example. Take the popular, at least in theory, digital contact tracing applications developed in many countries. We're still struggling with the fact of whether those are interoperable or whether we can share data when people start moving around. We're still in a situation where people don't move around a lot, but the idea of that, of these devices, is that we'll be able to move around and still, be able to perform contact tracing and proximity tracking that are essential for the control of the pandemic. So, and the last one, I think, what we saw, and it's a worrisome thing that we saw, is although we had this enthusiasm about technologies, we did see quite some confusion in the public, and I think that's not in one country only, about whether they can trust the digital technologies that we are putting out there, or they've been put out there for them. So we had polls and surveys showing that, well, if there is an application out there, 70% of the people were willing to use it. We have the technology out, and then the uptake of those technologies is very small. We have 18%, 12%, struggling to get to 20%. So the question is, why do publics and why do people actually are maybe reluctant to use the technologies that theoretically would have a positive impact in a very urgent issue like the pandemic? And I think these are things that I would very much like to learn from and carry over to, in what we're going to do, how we're going to deal with the digital in this process of the pandemic, but also on the way forward. Thank you.
Thank you very much. You just mentioned trust, which as usually is one of the first victims of any conflict or of any situation like this, and especially in these times where fake news, disinformation, manipulation is such an essential part of the game. Let me go to the second poll and see what our audience thinks about this question. You have it there. COVID-19 has accelerated digitization in healthcare, education, and the job market. Are you willing to do these activities remotely as a new way of life? The first answer is yes, the second no, and the third one, a hybrid way of doing these activities is the most feasible option. Okay, Let's move now to the policy and another part of the policy thinking with President Turk, with all his experience in policy making, both at the global and at the national level. And I would like to ask you, Mr. President, about the EU, because we are talking about global governance, but we also use, and especially here from Europe, we always use the EU as an example of integration and multilateralism and so on. And the EU has been working together with the member states to contain the spread of the virus and support national healthcare systems to respond to the COVID-19 pandemic. What actions would you like to highlight as positive in containing the virus? And do you think Europe could be an example for the rest of the world in this way? And to what extent we can think this crisis will strengthen the role of the European Union as a beacon of multilateralism? Please, the floor is yours.
Yeah, thank you, Christina, and I'm very pleased to be part of this panel and participate in this very interesting discussion. What I would like to emphasize is the importance of experience. I'm not suggesting that EU can be a model, or that EU can be a leader, or the EU can be seen as an ideal system, but I think EU should be seen as a place where interesting experience is evolving. And that experience is not all good, it is not all bad, it's mixed, and one has to really carefully appreciate that mixture. Now, I'm saying this also in light of the poll that was made with question 1, which I think emphasized the importance of national authorities, which I think is something worth thinking about. This corresponds also to the experience of the European Union, which at the beginning was seen as being quite unprepared for a pandemic. And then we had a first few weeks of practice and discussion which showed the limitations of the European Union. Those limitations were systemic. Healthcare systems are a national prerogative in the EU. They are not community-based, they are nations-based. And there are valid reasons for that. Many years ago, when I was president of Slovenia, I have discussed this question of internationalization of medical services, international certificates for hospitals and such things. And in various countries in Europe, I was told that, in fact, people, when they fall ill, they want to have their medical assistance close to home. And that's very fundamental, it's very psychological. So I think that that's something worth keeping in mind. Of course, in time of pandemic, many people have a need for medical consultation and medical assistance, and it would be natural that all this happens close to home. And that's a moment in which we can then see the differences between different national health systems in a very serious and very clear manner. And that is what happened in the European Union too. There was a period of time when people were asking, well, where is the European Union? The European Union couldn't be in place immediately because national health systems were the ones that were dealing with the new problem. So that was the initial part, and there was some criticism of European Union also. Now the key to the current and future work of the European Union in dealing with pandemics is, I think, coordination of national health system. It is not lifting this to the level of European authority, European jurisdiction, if I may put it this way. It's more about coordination of national health systems. I will come back to this towards the end of my remarks. But before that, I would like to say that obviously, after this first shock and the first set of experiences, which were very much national systems based and critical of the European Union, then we started to see the growing role of the European Union. First, in Slovenia in particular, but in many other countries, the European Center for Disease Prevention and Control became an extremely important source of guidance as far as the movement of the pandemic is concerned. Now, obviously, our national health professionals and leaders were looking towards WHO on the one hand for guidance, but increasingly to the European Centre for Disease Prevention and Control. And citizens who were watching press conferences and other governmental activity in that regard, they were always listening, here is what the European Centre for Disease Prevention and Control says, so it is probably well-founded. The assessment is well-founded and so forth. Subsequently, the European Medicines Agency played a role. The more we moved towards the question of vaccines, that became more important. And the European Union made a major step forward in early May when it convened a global pledging conference via internet, of course. It was a virtual pledging conference to organize help organizing and financing international action for vaccines production, and subsequently for vaccines availability. Now, to conclude, I would like to say the following. The experience of the European Union in this whole period between March and today is that we now see the European Union already being very active. The European Commission established the coronavirus response team, and it is dealing both with the medical questions on the one hand, with the questions of movement on the other, and the question of economic recovery as the third area. And none of these areas has reached a point at which one would say, all right, we have a complete sense of policy in place. For example, when we talk about the medical field, the problem of what is currently fashionably called vaccines nationalism remains a problem for the world and for the European Union. And I believe that Ursula von der Leyen, the President of the European Commission, spoke yesterday in the European Parliament, mentioning vaccines nationalism as a problem today. So, on movement, we see again now with the second wave coming in various places in Europe that restrictions in movement of people across borders are again discussed. There is no perfect solution as yet. And of course, recovery, there are basic decisions taken by the European Council, but much work will have to be done. Now, to conclude, I would like to say the European Union has gained valid experience. Now, that experience has underlined the importance of national systems, the importance of coordination among them, the evolving role of the European Union, and I think that has also an important message for the global world. Obviously, in the world as a whole, the problems are more complex. The emphasis of assistance to health systems which are not developed at the same level as in Europe, of course, is something that has to be a very major priority. But then again, we need to find ways of empowering global institutions, in particular WHO, making sure that WHO does its work as good as it can to see how to strengthen its authority and financial capacity. Both of these things have to be done. Now, it would take a great deal of political wisdom to find the right formula. I do not think that there are any easily defined solutions available at present. I don't think that the technology serves automatically. I think that the whole experience with tracing shows that people do not yet believe in the reliability of systems that are offered. And, there is much work to be done. So with this, I would like to conclude. Thank you.
Thank you very much. I guess that is one of the strongest dilemmas of our time. Up to what point technology can take over us as human beings in many of the tasks and challenges that we face. Let me share with you the results of the second poll. And here the answers are very much divided. 20% of the respondents said that they will be willing to jump to this new way of living with technology, a remote one. 30% says that no, and 50% says that in a hybrid way, sometimes yes and sometimes no, which is fine. I always I keep on admiring the fact that you are in different places of the world, we are in different places of the world, we are connecting and having this very interesting conversation live, and that is okay. And we haven't thought that this would be as usual several months ago, but we still need to get more used to this, to using these technologies for many other things. Let me go back to the conversation. We tackle many interesting things. At the end, they are all connected somehow. But I want to touch upon an issue which is very worrying, and it somehow at the end it seems that it's always neglected, which is mental health. And David, I wanted, you have extensive experience with this, and I'd like to ask you about the physical and psychological consequences for the population of this pandemic, and of this pandemic in combination with the technological challenges that we are also facing. What can you tell us about it? How can we fight this mental pandemic that we are also living?
Thank you, Christina, for providing a forum. In the United States, anyway, today is Suicide Awareness Day. In fact, it's Physician Suicide Awareness Day, which is even more poignant in some regard. And there have been suicides among physicians and caregivers across the world. And that's something we need to take into account as well, that it's not just the patients, if you will, although it really is all about the patients at the end of the day. But the caregivers are under enormous stress with changed conditions, with potential exposure, with limitation of protective equipment and surges. So the point that you bring up, Christine, is really important about mental health. Even before the pandemic, mental health often gets relegated to, or often got relegated to, a secondary position, which I think is a result of the stigma, which is a result in good part of residual dualism, where people don't really yet fully embrace the notion or understand the fact that the brain is the organ of the mind, and that psychological difficulties are brain difficulties. That doesn't mean that they're all biologically produced. In fact, the brain evolved in order to mediate interactions with the environment and to change itself. But it means that we have to have an understanding that links physical health and mental health, for which there's lots of data and support, and also understand the biological underpinnings and take away the blame and the misunderstandings about mental illness. Mental illness accounts for about 25% of the population in terms of people who have experienced mental illness. When you add alcohol and addictions, it goes way up. When you go above 50%, when you add medical illness and the psychological difficulties that can accompany medical illness or the effects on the brain and behavior, it can go up to 75 or 80 or 90%. So no one is immune. And there are different stages of life, and in a pandemic, things are exacerbated. The World Health Organization has shown with its data that depression, for instance, the disability associated with depression and mental illness is greater than that associated with cancer and heart disease worldwide. And so we need to understand, and the effect on work and productivity, let alone well-being, is profound. And so we need to understand these things. The incidence and prevalence have gone up for mental illness in the COVID era. Different studies have shown that upwards of 40% of people are experiencing depression and anxiety in significant amounts that interfere with their functioning. Specific populations who are often underserved or discriminated against and who have adversity, which itself is a stressor at baseline, have increased incidence. And the COVID has been associated with financial ruin for many people and stress, and there's a lot of political and social stress in the world, within different countries, and these are having tremendous effects. And so the ability to screen for and address mental illness, not just think about wellness, and to treat mental illness in an evidence-based way and provide access to care is really important. And telepsychiatry has emerged as a really impactful way to do this efficiently, and also in terms of being able to be in touch with people more frequently, whether it's synchronously or asynchronously across space and in places where they may not have access otherwise to mental health or to expert consultation. What we're seeing now also is the use of passive sensing technology and apps, and we can collect more than 1 million data points per day per person and use and develop and test AI algorithms to be able to analyze those data streams, integrate them, and to pull out information that provides an air traffic control sort of sense and a real world, real time sense of the patient's physiological and behavioral and psychological status. And so that we can start to get to, in ways that honor privacy and also that emphasize connection for people who don't have it yet, we can start to get to a situation where we can be more proactive and preventative and bring groups together and utilize new ecosystems online in order to do that. So I think there are both tremendous problems at baseline, increases with COVID and all the political and economic and social sequelae of that and other problems, and then with increased awareness and with technology and taking into account the potential limitations and dangers, there are some new ways that we can hope to address this at scale.
Thank you very much. Those figures are really impressive. In many cases, the neglect of mental health is due to the lack of resources and to the allocation of those resources to other issues or to other fields even in medicine. I'd like to go back to the global governance arena and ask you about the recommendations of the High Panel for Digital Cooperation. But very specifically, I would also like to know whether among those recommendations are specific points to address the breach. You also mentioned the lack of resources, because you've mentioned connectivity, you've mentioned inequalities, and among those recommendations, how can we make that gap smaller?
Mm-hmm. Thank you so much, Christina. So I think I can pick up on two aspects. And here I want to talk a little bit about the recommendations of the panel as well as the Secretary General's roadmap in response to what I think it was Effie and actually President Turk had mentioned. So Effie had talked about how this question about why people are reluctant to use technologies, and you, Christina, had said that it goes to this issue of trust. In the same way, I think President Turk had said that, when it comes to technologies, these are not easily defined solutions, and that technology doesn't automatically serve the people and the public. And all of this, I think, wraps towards this idea where in global governance of digital technologies, there is the challenges and the pitfalls of technology not being used well, which then leads to, as you had mentioned, Christina, this trust deficit, whereby people are afraid to use technologies because they are concerned of the possible risk and the pitfalls, and the fact that, for instance, technology can be used against you, right? There was a mention by President Turk of the concern over tracing apps that we are now using COVID-19, whereby it's an infringement on human rights and your personal data privacy and so on. So all of this goes to the heart of how far can we trust our digital environment and how far can we promote trust in the digital environment such that people can be encouraged to use these technologies wisely. How then can we ensure that even the private sector companies that deploy these technologies, the governments that use contact tracing apps, for instance, do so in a manner that's human rights compliant, that is robust, and that respects individual privacy and individual rights. And this is a core issue, I think, that was taken up in the high-level panel as well as in the Secretary General's roadmap. I had mentioned that the issue of digital human rights, for instance, is a key topic that we pick up on in great detail in the Secretary General's roadmap. The call to respect people online is a reflection of the fact that rights that exist offline must exist online as well. And you will see in the Secretary General's roadmap, for instance, he specifically expresses concern over data privacy issues, the use of surveillance technology, especially in the wake of COVID, the use of facial recognition and artificial intelligence systems, which can perpetuate biases against minorities, can be used in a manner that is violating of human rights. So all of this points to the need to manage our digital environment in such a way that there really is a fostering of digital trust and security. Interestingly, there is a recommendation in the high-level panel and carried forward in the Secretary General's roadmap that asks for the member states to come together around a global statement on digital trust and security to achieve the Sustainable Development Goals. A recognition that if we create a secure and safe and trustworthy digital environment through cooperation between governments, tech community, as well as civil society, that then fosters the trust that we need for the individual citizens and the people to use technology in a way that they know is secure, and they know that technology companies and the government have actually come together to create the necessary frameworks and standards that allow for the safe and inclusive use of digital technologies in the internet. So this idea of digital trust and security, I do think, is quite fundamental to how we can carry out the use of technologies in a way that does benefit all of society, at the same time managing these issues of trust that you had mentioned and that Effie had pointed to. I also want to pick up on this idea that you said, is there enough commitment and resources to achieve what I talked about earlier, the closing of the digital gap? And here I think what President Turk had explained in terms of the history of how the European Union had gradually come to an understanding about the responses to COVID-19 pandemic, starting off with national authorities, and then gradually also reflecting on the role of the multilateral institutions like the European medical resources, and so forth, is instructive. Because you are right, it has to start with national governments showing the political willingness needed to mobilize the resources that we need. But at the same time, we as the international community and the United Nations can galvanize action by pointing to the gradual steps that are needed. The resources needed to connect the unconnected are not insignificant. The International Telecommunications Union, for instance, has estimated that it will cost $428 billion to connect 3.6 million people, the current unconnected people around the world, by 2030. $428 billion that has to be met in some way or the other. Some people actually say that this estimate is actually conservative and that the number goes up to several scales higher. So what we do need then is the political commitment and the will of the international community to then mobilize the national understandings and the political resources at the national level to try and meet this critical need. And this will have to be a partnership between national governments as well as multilateral institutions, as well as concerned members of society. The last point I want to touch on is something that President Turk had mentioned. He said that coordination at the national level is actually complicated, and that when it comes to national authorities, it does take a lot of effort to get national authorities to get coordinated in a fashion. I would add that it's another level of complication when it comes to digital technologies, especially in the wake of COVID. It's not just national authorities. We also see private sector companies, national private sector companies, that have no engagement with national, no sort of, in some ways, reporting line to national authorities. So your tech company, your Google, your Facebook, your Microsofts, these are not in some ways answerable to your national authorities because they have their own ways of working and so forth. So national legislation only goes so far as to regulating the work of private sector companies. And in many areas, for instance, in content governance, in responding to content online, in privacy laws, we are depending a lot on what the policies and practices are of the technology companies itself. So that is that added layer of complexity to it. It's not just about coordination between national authorities. It's also about coordination with private companies, technology giants that in many ways transcend borders and no longer are answerable to one national authority, but actually, because of their global operations, have multiple facets to how they actually operate. And that really creates a new layer of governance that we have to contend with.
It is the perfect point to engage with the question that arrived from the audience, and it is for President Turk, because the question is who should take the political leadership to move forward this desirable global cooperation that we are talking about, to make true this political will that we need to advance.
Well, we live in an era of a great paradox. I think that rarely in human history the needed, or the objective, the needed was as clear as it is today. But at the same time, the political will and political leadership being extremely weak. So we have an important and very fundamental paradox here. Now, let me move again to the European Union and explain that obviously leadership will not come from a vacuum. Leadership comes from those who are capable to lead. And European Union has a certain capacity to lead. It's not total, it's not the greatest capacity in the world, but it's an important capacity. So I think that COVID-19 has created a shock for European Union, which could actually be quite salutary. A shock that requires European Union to do new things within the Union, and to do new things globally. Now, when it comes to doing new things within European Union, it is recognized, tech giants today are not located in European Union. They are all in the United States and China. So there is much to do at home. There is much to do in the European Union to strengthen its capacity in new technologies to make the European digital strategy a realistic one. Today we are still in the state of shock. I mean, the shock that, all right, we have to do something big and something soon. And hopefully that shock will suffice. I'm not pessimistic in that regard. And Club de Madrid will be participating in the discussions which are now evolving in the European Union. I think that the statement of the President of the European Commission yesterday in the European Parliament went in the right direction, offered a good platform, and I think we need everybody in the European Union who can help to move that process from the stage of shock to the stage of more creative and leadership role, both at home and internationally. So that's one thing. The other thing is European Union can engage major partners. European Union will be, of course, negotiating major agreements with China before the end of this year, and if that succeeds, that could help also others. Again, I think that the current political discussion around the world and the current prevalence of the American criticism of China is unhelpful. There have to be examples of cooperation for the future, and they are not limited to classical investment and trade issues. They are broader, and they include health sector today. China has explained in the past that it is willing to accept foreign presence in their national health system. Now let's see what happens in that regard. So leadership at the global level requires also partnerships. We'll see what kind of partnership will be possible between the European Union and the United States. And I'm very cautious here in this regard, because obviously we are all waiting for the outcome of elections, for the elections in the United States in November, and its outcome which will define the role of the United States in this complicated world. Now, leadership obviously is not something that happens spontaneously. It has to be developed carefully, with determination, with proper thought. And the shock of COVID-19 should help us in that regard. European Union could be among the early harbingers of new type of leadership, but it can't be alone. There have to be other players. And I'm not diminishing the role of other countries around the world or of the private sector or of other actors who have an impact on the global world. What I do emphasize is one has to start somewhere. And that somewhere, I think, today is European Union more than anywhere else. Although, again, I'm not suggesting anything unrealistic in that regard. European Union is not yet at the point when it can show that leadership fully. But it has undergone a shock which is moving it in a good direction. And well, let's help the European Union to develop its role properly. And if that happens, then of course the solution of many issues that are more practical in character could also be easier, including WHO. We know that the evaluation of WHO experience with COVID-19 is due later this year or perhaps early next year. And again, it will be necessary to have leading powers to help moving our global system in the area of healthcare or health policy to new levels. And again, European Union can be helpful in that regard as well.
Okay, thank you very much. I would go back briefly to the issue of data and the governance of data. And I would like to ask Effie, you was telling about it before also, in your experience with the Swiss Federal Institute of Technology, in creating a cooperative governance for health data, how can be used for the common good, while at the same time ensuring the citizens' control and guaranteeing privacy and personal data? How are you envisioning this, combining both aspects, privacy and common good?
So there have been some initiatives in changing the kind of governance that we have available for particularly also health data. And one model that emerged as a possibility is the cooperative model. In that case, individuals don't only make decisions about how their own personal data are going to be used, because we do, I suppose, have the understanding that, you know, somehow our personal data are needed and will be used in one way or another. So the decision and control is not only on your own personal data, but if we operate in a sense of commons, then we can make decisions about the broader uses of this pool of data for particular purposes. The idea of commons and the idea of cooperative governance has an appeal, and I think has a lot of potential. But again, if we look around us, we haven't seen this taking really off. Which is something, again, that we can use as a lesson. If we had some form of cooperative governance, I think also in the case of the pandemic, maybe some of the issues we've dealt with would have been easier. But as with as the other speakers also mentioned, it was a shock to many institutions. And one of the things we saw is that some also of the theoretical models we had put in place that we thought they may work in governance, they actually didn't perform as well. When it comes to the issue of privacy, again, the cooperative model doesn't necessarily and automatically takes care of the privacy question, but it is a collective kind of response to this challenge of privacy. I think one issue we saw here also, in particular during COVID, is that in many cases we're rather quick in sort of interfering with personal freedoms and including privacy for a good reason in some cases. But the big question we'll have to deal with right now is for how long. President Durk just mentioned that we're still struggling with the issues of movement in Europe, that of course we haven't resolved the vaccine, we're far from it, or its distribution, or production or development still. We're also, I think, still struggling with how we're dealing with the issue of privacy. How permanent our temporary policies are going to be, and how are we going to legitimize some of those decisions that we're making. Now, would a cooperative type of governance would have taken care of all of that? I'm not so sure about it, but I think it would have maybe given more people the opportunity to deliberate about how to go about some of these issues. And I think what we saw a little less during the crisis, and we're not out of the crisis yet, but during, let's say, the peak we had in the spring, is that deliberation about how we're using the data, or what can we do, or where we should stop, what are red lines, was actually quite limited. In the models of governance that we would have envisioned and had envisioned, that deliberative aspect was actually more prominent. Of course, you can say we're in a moment of an acute crisis. There is no time for the deliberation. But as we're seeing this crisis becoming more of a marathon than a sprint, I'm a little concerned about where have these ideas about deliberating, about legitimacy of our choices in relation to restricting freedoms, etc., have gone. And I'd be actually very happy to see also in this continent where we are in Europe that this is becoming, more attention is being given to that issue. And it goes along with the governance question, in my opinion.
We might see it as an important issue for the coming conference for the future of Europe that President von der Leyen is promoting in these coming 2 years. So there is this intention of being more deliberative and having more participations of the citizens. So we'll see. We are reaching the end of our session, and I would like to ask you to I'll give you 2 minutes each to either summarize or make a remark or a statement, whatever you want. But I'm also posing you a question that arrived from the audience that I think also summarizes the topic of this session. The question says, the pandemic has revealed fissures among leading supporters of the multilateral system that have hindered effective response. How can we strengthen multilateral coordination for global public health in a fragmented and increasingly contested context? We've talked about it somehow, but if you want to include a quick answer to this question in your final remarks, you will be more than welcome. Who wants to start, please? Effie, for instance.
Okay, well, I'll start. So 3 things for me are really important in conclusion. I do believe that we should really remain very committed to protecting and respecting human rights and freedoms. I think this should be a lesson that we get out of this pandemic, and try to avoid exploiting the crisis in sort of infringing upon rights and violating them. And we have plenty of examples already of this happening. I think I would like us to be quite careful about how much the permanent, permanent the temporary is becoming, and how legitimizing actions that we're taking. And again, how to avoid that inward looking that I think the pandemic made us do, the looking towards our own in the smaller scales doesn't really prevent us from connecting with the others. This idea of otherness that I think we saw very much. To the question of the audience, my feeling is that we need to look more carefully at our international institutions and what they can do for moving us forward. And we do need revisions of these institutions. They have served some time, but the fact that they served us for some time does not mean that they should look the same for the years to come. And now it's an opportunity to look and be bold and honest about what worked, what it didn't, and quickly move to revising what's not working.
Thank you very much, David.
Thank you, Christina. And it's such a pleasure to be listening to my colleagues, all of you, and I think this is a truly interdisciplinary discussion. I'd like to close with an emphasis on health literacy and behavior, and science literacy and behavior, or fact literacy and behavior, as the case may be. I think that so much of what we're seeing now that is disturbing and unnecessarily complicating is because of the politicization of health. And we need to transcend that. And we need to do that in ways that are both proactive in terms of education and information, and creating a more informed populace and reinforcing civic society in the context of democracy and the freedoms and protections that were talked about. And we also need to do that in terms of addressing the bad actors, whether they be nation states or terrorists or companies or individuals out there, so to speak, who are literally stoking the flames of division among different peoples, instilling fear when there needn't be, reinforcing conspiracy theories that lead to problematic behaviors at best, and are involved in the denigration or the questioning of science. And all of us would be called so-called elites, and telling people not to listen to us and so forth, as if we mean ill or are ill-informed. And of course, we have our limitations. But I think the populism, the disinformation campaigns by certain countries that are deliberately creating questions in people's mind about vaccines, about masks, on and on, are tremendously dangerous. And I think we need to be more proactive in not only enabling and building health literacy and education and science literacy and education, but in combating and deterring and punishing the bad actors.
Thank you. Hugh, please, the floor is yours.
Thank you so much, Christina. I'm going to, I think, expand a little bit on what Effie said, that really, I think it's a number of things. One, I agree with her completely that human rights has to stay front and center in what we do in our responses to the pandemic, as well as going forward. I also think that this issue that she mentioned, which I really think goes to the heart of it, this idea that we shouldn't lose faith in our multilateral institutions. So while we start off with national authorities and we recognize the role that national authorities and governments play, there has to be a sense in which we are still in this together collectively as an international community. And this is where I think that the political commitment of all of us to those multilateral institutions, be it the European Union, be it the United Nations, has to be that sense of which it is not just individual governments, but us collectively coming to find global steerage for digital technology, as well as these global crises like the pandemic and other crises that might arise. So that commitment to at least raising the discussions to that level and being willing to countenance the idea of some kind of global governance system, or some sense in which there must be a consensus or universal understanding on the way forward, is fundamentally important. I do agree that there will be a need to update the way we discuss things, because clearly the United Nations and other international institutions will not be able to proceed as it has before the pandemic. There needs to be a way of looking back honestly at what we've done right and what we need to innovate in order to be more significant and impactful going forward. But that still requires, at its very heart, a commitment to believe that these institutions still can make this kind of difference. When it comes to technology and the digital space, I think this is more fundamental. I also want to make another plea to really reflect on the fact that it requires a multi-stakeholder approach. These governments and so forth, technology companies and the private sector must be players in this conversation as well. And in this effort to have global governance and to have a cooperative approach to the universal or international systems that will allow us to better harness technology and mitigate the challenges. So my ending message, I think, is really an ask, a call for everyone to join us. Is the United Nations works towards the Secretary General's roadmap, and it's called to connect, respect, and protect all people in the digital age.
Thank you very much. Mr. President, the floor is yours.
I would like to remind ourselves that this is the year of the 75th anniversary of the United Nations. And there is one word which I think is critical for the United Nations today and into the near future, and that is persistence. United Nations as a system, thinking not only about the UN, the core United Nations, but the entire range of its organizations, is an incredibly rich repository of knowledge, understanding, wisdom, and options. And what is needed today is persist with the identification of priorities which is already there. We all know, there is no argument to say that pandemics can be effectively addressed unilaterally. Unilateralism will not help us, will not take us anywhere. Multilateralism, through the existing repository of knowledge, understanding, wisdom, and option, should be made use of. And that applies obviously to pandemics, which is the framework in which we are discussing issues today, and also when it comes to the other major need of humankind, and that is to curb global warming. The same kind of persistence is needed. Much work has been done in that regard, and we are not yet anywhere close to the needed effectiveness of work. But the way towards future is about persistence. We have to persist in that direction. Now, I think that digital strategies can be a wonderful tool, but they are not the objective, they are tools. And I'm sure that if the policies are created with an appropriate level of understanding of multilateral potential, then the capacities that already exist in the digital sphere can be put to a very good use. That's the sequencing which I think is important nowadays. I'm not talking as a technical expert, because I'm not. I'm talking as a person who has been in the United Nations for many years and who has been involved in national policy making as well. And I know that we have no better option than the ones that I'll try to outline. And again, persistence is the way to the immediate future. Thank you.
Thank you so much. We've run out of time. Thank you all for your very interesting insights and contributions. I'm sure all of us will remain thinking about many of the things you've said during this session. And I'd just like to finish with sentence that the President of the European Commission, Ursula von der Leyen, said yesterday during her speech. She said, "We need new beginnings with old friends from the other side of the Atlantic and from the other sides of the Channel. We need new beginnings with all the world, in fact, because all these challenges, as you have all said, need more multilateralism. We cannot face either a pandemic or global warming without collaborating and cooperating. So thank you very much. I hope this will inspire other people to go on with this work. Thank you.
Thank you.
Thank you.
Thank you.
Thanks.
Thank you, Christina, President Turk, Yuping Chan, Dr. Silbersweig, and Professor Baena for a brilliant, wide-ranging, and truly visionary panel. Since we can't take our normal coffee break and have conversations in the hallways, we are now going to offer all participants in our policy lab about 10 minutes to network before initiating our final session of the day. Please go to the networking tab on your screens, and you will see 3 rooms available to speak amongst yourselves. We'll be back with you at 11:50 Eastern Standard Time if you're in the Americas, or 17:45, 5:45 p.m. if you're in Europe, for our final panel session of the day, analyzing policy frameworks for artificial intelligence. See you in 10.